We start with breaking news this evening. College Station police are investigating a shooting that took place at John Crompton Park in College Station. One person was transported by ambulance to a local hospital. The crime scene surrounds the basketball courts at the park, as well as a portion of the Campus Crossing apartments across the street on Sienna Drive. College Station police ask if you have any information to call 979-764-3600. The CDC is changing its guidance on mask wearing thanks to a massive uptick in COVID-19 cases. The agency now saying vaccinated people in some parts of the country should again start wearing masks indoors in public areas. The guidance applies specifically to areas with high or substantial COVID-19 transmission, which accounts for nearly 2/3 of the U.S. counties. The CDC also wants communities to encourage all teachers, staff, and students to wear masks in class, regardless of vaccination status. The Brazos County Health District announced today it will receive $1.9 million in state funding. The funds are coming from the Texas Department of State Health Services. $400,000 will go to hiring community health workers and a health equity coordinator. The other $1.5 million would go to expanding clinical services and adding new nurses and staff to the district. The state of Texas announced the first case of West Nile virus in a person. The Dallas County Health Service confirmed the case today. The virus is transmitted through mosquitoes. Several mosquitoes with the virus were found across the state, including here in Brazos County. And both the University of Texas Longhorns and the University of Oklahoma Sooners announced today both apply to become members of the Southeastern Conference. SEC Commissioner Greg Sankey said the league would consider the request in the near future. The request to join would start on July 1st, 2025. Baylor University issued this statement this afternoon, reading in part, quote, "A strong Big 12 is beneficial for the state of Texas as the state benefits economically and reputationally from maximizing the number of schools it has playing in Power 5 conferences. You can be assured that Baylor is committed to competing at the highest levels of intercollegiate athletics and maintaining our positions as one of the most successful athletics departments in the country." The Texas A&M Board of Regents announced it will meet tomorrow to discuss the latest SEC news. The board also met yesterday but took no action during the meeting. Lieutenant Governor Dan Patrick announced that he created the Senate Select Committee on the future of college sports in Texas. 11 state senators were appointed to the committee. 3 House members representing Lubbock, Fort Worth, and Waco were added to the committee. Those cities have Texas Tech, TCU, and Baylor. Texas A&M Engineering Extension Service wraps up their annual fire training schools this week, normally 3 weeks in July, where thousands come in for specialized training in the fire industry right here in Aggieland. KRHD News reporter Hannah King speaks to those visitors and shares the impact these men and women could have on area businesses and what skills they are taking back home with them.
Soaking up life-saving knowledge to take back to their own communities, all while helping our own right here. These courageous men and women are making an impact.
It's amazing, like once in a lifetime. So, I mean, you can't recreate this anywhere. The amount of people, volunteers paid, all the instructors, like you meet people from all over the state of Texas.
Historically, all 3 fire schools combined bring in an estimated economic impact of nearly $6 million to the community each year.
It's nice to give back to the community because they're housing us, they're putting up with us like the whole week we're here, so it's nice to invest our money back in a place that's always welcoming.
Using what they've gained throughout week-long training in Aggieland to take back to their home departments. It's something they say they can only get here.
They'll send a group of us every year, so that group gets to go back and teach their shift. So basically they try to want a shift, and we'll go back and we'll be like, hey, this is what we learned, sit down, talk about it. And it's nice to, some firefighters have different training than other firefighters, so it kind of like mends us all together.
In College Station, Hannah King, KRHD News.
There's a surge in COVID cases in Tokyo as the Olympics continue. The city reported its highest number of new infections the day after the games started. Japan's prime minister said there was no need to consider suspending the games. Simone Biles taking a step back from today's women's gymnastics final at the Tokyo Games. It follows an Instagram post yesterday expressing the pressure that she felt after making it through the prelim competition, saying, quote, "I truly do feel like I have the weight of the world on my shoulders at times."
They're just under intense scrutiny to perform, both physically and mentally. And so when you think about that intense pressure to compete and win at all costs, it comes at a cost. And so we're so proud of her for being bold and also looking after her own self-care in this World Olympics.
Suzanne Potts is the director of Athletes for Hope, which works with Olympic, Paralympic, and collegiate athletes to better their mental health. Now, she hopes the move from Biles will be a big step in eliminating the stigma that many athletes feel around mental health. In a press conference, Biles said that she feared getting hurt if she continued on with the competition because of her mental state, and she felt that her team, which did go on to take silver, would do better without her.
You certainly know there's a correlation between your mental health and your physical health, right? And so if your mental health isn't in check, then the ability to succeed in your sport is diminished.
Now, on top of being on a world stage, athletes at the Olympics are also feeling the weight of the pandemic. A lot of their typical support can only be there virtually due to COVID restrictions. Potts says Biles set a good example by confiding in the people who were at the competition, like her coach and teammates.
Finding out how other people are doing can also be very helpful to your own mental health. And so having her check in both with themselves or with others, I think would be a nice step.
Biles says that she's unsure if she'll compete again while in Tokyo as she focuses on mindfulness. Her next competition is scheduled for Thursday. Well, the pandemic brought financial concerns front and center for many, and now more people are buying life insurance because of it. Next in our lineup, why coverage has been especially popular among Black Americans.
Good food helping out the Special Olympics and your first responders. Straight ahead, we look at how you can take part. Local law enforcement officers are participating in the Special Olympics Tip a Cup fundraiser this week at Texas Roadhouse on University Drive. I stopped by the restaurant this evening for a quick bite to eat and see what makes this fundraiser so special to our men and women in blue. If you're struggling coming up with what to have for dinner this week, here is a tasty suggestion: Texas Roadhouse.
Our local law enforcement agencies are going to be assisting the waitstaff with your dining experience. We'll be doing the easy stuff, get more rolls, refilling drinks, bringing a ketchup or a to-go box, and it's just working for tips, and our tips go towards Special Olympics.
Law enforcement officers are keepers of the flame for the Special Olympics, and each year officers participate in fundraisers like Tip a Cup to make sure the games go on.
We want the Special Olympic Games to continue because it gets the athletes out of the house. They're socializing, they're staying active, they're staying overall healthy, and so we want to make sure the Special Olympic Games happen, and they can't happen unless we raise the money to be able to pay for the entry fees and get them to all the games.
Brazos Valley Law Enforcement has been participating in this fundraiser for over a decade and says it gives the community the opportunity to not only give back to a great cause, but also connect with local law enforcement.
I think it gets the patrons to see us as law enforcement in a different light. They see us giving back to our community. And it helps promote that sense of community for everybody.
And this year, Brazos Valley Law Enforcement is hoping to raise the most money yet for the state's athletes.
The first night we made $9,000, which is the highest Monday night that we've ever done here. So we have high hopes. We're trying to get to Thursday night and break that $40,000 mark. So we just need folks to come out, enjoy a meal, and donate to the Special Olympics Texas.
And if you missed the fundraiser tonight, don't worry. Tomorrow night is Aggie Night, followed by Torchon Night on Thursday. Learning to read is a critical part of a child's experience in a school. Students with dyslexia face more challenges, but one school opening in College Station is dedicated breaking down those barriers. Kristen Pitts uses these books to help her students learn at Happy Camper School. Her passion to help students with dyslexia started in her first year of teaching. Finding out her two daughters also have dyslexia inspired her to open the school to help even more students turn a new page in their lives.
These books, we are actually teaching them to rely on the decoding strategies that they've been taught. So if they've learned closed syllables, for example, they know that the A with that consonant after it's going to say the ah sound, and it's consistent and reliable.
These books come at a hefty price, putting the tuition at $12,000 per student. HA is still trying to offset the cost by launching her nonprofit, Brazos Valley Dyslexia League, and asking donors to sponsor a student. Well, now let's get a check of the weather with First Alert Chief Meteorologist Matt Hines.
And we can confirm that it's still hot outside Brazos Valley, and it's probably going to stay that way as we head through the rest of this week. However, there will be a couple subtle changes over the next couple of days. Right now, though, it's just steamy. Temperatures around 90. Still feels like the mid to upper 90s, so it is definitely humid. Look at that dew point, 74 degrees. So we are looking at a very warm night, and it will continue to be that way across the area. Clouds and radar showing that we do have a few showers and thunderstorms off to the east of us. But right now, it appears that a lot of that is going to stay off to the east. However, that disturbance will eventually roll farther to the west, and we may have a slightly better chance of some widely scattered showers and thunderstorms as we head into tomorrow, as that again slowly pinwheels back toward the I-35 corridor and eventually West Texas by the end of the week. So our latest future track not showing too much for tonight. As we head into the morning hours, again, maybe an isolated shower storm far eastern areas near I-45. That's going to be about it. Then notice some pop-up thunderstorms for tomorrow, so that will be a possibility. About a 30% chance you'll get wet on Wednesday, and about a 20 to 30% chance again as we head into Thursday. Not a lot of rain out there, but it's better than just saying it's just hot all the time, so we'll take it during the month of July. And checking out our forecast for tonight, temperatures falling down into the mid to upper 70s, between 76 and 78. Then tomorrow, highs into the mid 90s with more clouds around. It shouldn't be quite as hot here across the area, but we are going to be seeing the humidity values make it feel even warmer than it actually is. So about 95 for tomorrow, 96 on Thursday, 20 to 30% chance of rain goes through Friday. We get to the weekend, highs will be into the upper 90s, probably just shy of 100 degrees. Then a front gets closer to us as we head into early next week, and that will bring a chance for a few showers and thunderstorms, and temperatures may try to come down a little bit by Monday, Tuesday, and Wednesday.
The number of people buying life insurance in the first part of this year is the highest it's been in nearly 40 years. LIMRA, a research organization for insurance companies, tells us these increased sales could be what happens for the next few years. Now, after the Spanish flu pandemic, they say that life insurance sales went up pretty steadily for about 4 years. Company CEO thinks that we could see that trend as well right now. And he says that Black Americans are seeking out life insurance at higher rates than other racial groups. And a recent study from LIMRA finds 56% of Black Americans now own life insurance, which is up 3% from 2020, and it's 4% higher than the rest of the population. The study found that Black Americans report a higher level of financial concern, and COVID-19 made these concerns worse.
When we look at things like, the mortality rate, when we think about things like the infection rate, it was just disproportionately high in the Black community in this country.
Nearly 60% of Black Americans in the study say they plan to buy life insurance in the next year. That is compared to 36% of the rest of the population. But Black Americans are also more likely to overestimate the cost.
If you took a 30-year-old, a healthy 30-year-old, and they purchased a $250,000 term policy, that might cost anywhere from $150 to $200 a year. But people overestimate that cost, and people are saying that if I had to guess, it would be 5 times what it truly is.
The main reason Black Americans think insurance is needed is only to cover funeral costs. LIMRA's CEO says that perception could mean they don't end up buying enough coverage for income replacement to help after a loved one dies. One of the biggest questions among COVID researchers is, will there be another surge of the virus in the fall and the winter? Researchers at Johns Hopkins analyzed all of the current data to come up with several projections, including best case and worst case scenarios. Maya Rodriguez spoke to researchers about their findings.
COVID cases are surging across the country and no longer mainly impacting older Americans, but rather younger.
In our ICUs, we are seeing younger people intubated who are very sick or who are on the floors and are very sick. That should be a gigantic wake-up call.
Another wake-up call? Researchers at Johns Hopkins University just completed their 7th round of COVID case projections, something they've done since the start of the pandemic.
So what we were trying to do with this is really fill the gap of, that longer time span. So looking out 6 months.
Which fast forwards to what the virus might bring for the country in cases and in deaths by the end of the year. Here's what they found. In the best case scenario, which is a high vaccination rate and a variant with low transmission, COVID cases only rise by 3 million through the end of the year, with just over 32,000 additional deaths. But that best case scenario runs into two problems. First, COVID vaccination rates right now are stagnant.
The challenge we're seeing now is that vaccination is slowing down because of uptake issues of hesitancy, people not being willing to get vaccinated.
The second problem, the Delta variant is highly transmissible and the dominant COVID strain in the U.S., now accounting for 83% of all cases in the country.
But what we're seeing because of that, and because of this stagnation of vaccination, is that we do expect there to be some resurgence in the fall.
In the worst case scenario, researchers looked at lower vaccination rates combined with a highly transmissible virus like the Delta variant. COVID cases rise much higher, by more than 7 million through the end of the year. And there would be more than 95,000 additional COVID deaths, triple the number of the best case scenario. Researchers say what all of this means is the more people who choose to get vaccinated, the less likely the worst case projection and many more deaths become a reality.
While these resurgences are not necessarily to the same level that we saw in winter 2021, they are substantial enough to be concerned about and aware of.
Information that Johns Hopkins researchers hope will reach those who need to hear it. In Washington, I'm Maya Rodriguez.
Traumatic brain injuries are usually associated with athletes, but there's another population that, according to research, is even more impacted. We're talking about the prison population. Researchers say TBIs impact decision-making and impulse control, which can lead to people to reoffend. Vanessa Mashania talked with two former inmates who made it their mission to fight recidivism by informing others about these injuries.
Markel Taylor Bay has made mistakes.
I was always snappy, agitated, impulsive.
While serving a 21-year sentence for robbery, he wanted to put those mistakes in his past. He educated himself about business, found a business partner, and when he got out, they got to work, but he soon found himself back inside.
36 days later, after doing 21 years of incarceration, I went and robbed a Papa John's pizza. My brain just shut down, and people was wondering how, after doing all of this time, having the business education he have.
While he takes ownership of his actions, Markel learned about ongoing research from the University of Denver that suggests he was also a prisoner of his own mind.
Didn't know I had a traumatic brain injury. I didn't even know I had mental health issues.
The CDC defines a traumatic brain injury, or TBI, as an injury that can affect how the brain works. Caused by a blow to the head, it's a major cause of disability. New findings by researchers estimate that 50 to 80% of America's prison population has had a TBI. Outside of prison, less than 9% of the general population has had a traumatic brain injury. The statistics are worse for incarcerated women. 97% have had a traumatic brain injury, and half have had multiple. The results of this groundbreaking research was shocking to the study's author, Dr. Kim Gorgans, who has been speaking out since, including in this TED Talk, which she provided to us.
In this way, these women's brains look like the brains of retired NFL players. And they'll likely face the same risks for dementing diseases as they age.
Dr. Kim Gorgan's research has shown that TBIs can impact someone's ability for self-regulation, judgment, reasoning, and problem solving. And that, she says, can lead inmates to reoffend once they get out of jail.
Trauma is the only thing that we let get to a stage 4, before we start to treat it. And the treatment is prison.
Corey Shively met Markel in prison and is now his business partner at their marketing company. Thanks to the study, they both discovered TBIs they suffered while they were younger have impacted their judgment and impulse control and are now getting help for it. They've now made it their mission to educate their communities about traumatic brain injuries.
We should have better resources in our community to be able to deal with this trauma up front. We shouldn't have to wait till Markel's 47 and I'm 40 years old for us to get some therapy.
They've taken their mission to the Colorado state capitol with hopes of changing policy across the nation. They helped create a new law that mandates neuropsychological exams for inmates once they get sentenced. If a mental illness or brain injury is detected, psychologists make two plans, one for prison staff to manage the inmate and the other for the inmate on how they can better themselves, all with the hope of reducing recidivism.
They're going to be able to see what's going on with their brain, become more aware, and, like we like to say, trauma-informed, trauma-conscious, trauma-responsive.
Markel hopes that this is just the first step in helping people like himself recognize their own disability to make themselves and everyone around them safer.
We're here to help this state be returned back to a baseline state of safety so people can operate effectively and they don't have to suffer in silence.
I'm Vanessa Mishanya reporting.
Finally in our lineup, the vaccination rate among doctors is high, but it's not the same story for other healthcare workers. The new high-profile push to require the vaccine. Momentum is growing for mandatory COVID-19 vaccines. The Department of Veterans Affairs now says that frontline healthcare workers need to get the shots within the next 2 months or they may be fired. New York City and the state of California are telling government workers to get vaccinated or face weekly testing. And there's also a push from a unified voice of nearly 60 healthcare associations saying the healthcare community should lead the way in requiring vaccines for all employees.
And to get this pandemic behind us, we need to get as many people vaccinated as quickly as possible. And unfortunately, it's come down to talking about mandates.
The American Medical Association is one of the groups supporting vaccine mandates for healthcare workers. Now, it's not an uncommon requirement. Healthcare institutions require workers be vaccinated against other diseases. More than 96% of physicians are vaccinated, according to the AMA, but the numbers aren't nearly as high for other healthcare workers.
I'm afraid they've been exposed to misinformation and disinformation, just like everyone else.
We thought it was important for us as a healthcare community to say it's mandatory for all of us to take vaccine. There's overwhelming science to support its safety.
Both healthcare organizations stress there is an ethical and moral responsibility for healthcare workers to be protected and protect others from infectious diseases. Dr. George Abraham with the American College of Physicians says many organizations were waiting for a unified voice on vaccines from the scientific community.
The statement applies to healthcare workers for now. We are not saying it is across the board for everyone in the public, but the message is clear that if we don't take a stance, then no one else is going to follow.
Drug and alcohol treatment counselors say they are becoming increasingly concerned about addiction numbers rising. Tomorrow, what they say needs to be done to prevent numbers from spiking amid new talk about restrictions, even involving those who are vaccinated.
Jimmy Kimmel is up next. Good Morning Texas is on the air tomorrow at 5 a.m. Thanks for joining us. Have a great night.